Namaste all. Welcome to the new video. This topic is all about the dose of sneha, that is Snehapana Matra, for both Shotananga and Shamananga snehas, that is for Shotana purpose and also for Shamana purpose. Today we are going to deal with the dose. And all we know, the dose is mentioned in all the classics. It's not like 3 to 5 ml for children, 10 to 24 ml for adults. This is not the way of explaining the dose for Snehapana. For Snehapana, it is like the amount of Sneha which will get digested after this much hours or this many hours or after this many day. So this is the way of method of explaining the dose of Snehapana. Why this method is used, that is explained in the next slide. Here there is Purusham Prati. That means Purusham Prati means we have to consider each and every person for their disease status, for their strength, for their digestive capability, for their capability to withstand the amount of sneha. So all these things has to be considered before the administration of sneha. So the dose is not a fixed dose for every adults. The dose is not a fixed dose for every children. The dose is not at all fixed. But we have to fix the dose based on the capability of digestion, based on the strength, based on the different types of diseases, etc. And that we will deal in the next sections. So there are mainly three types of sneha patras are there. One is ahoratra, that is the pradhana matra. Pradhana matra is the ahoratra. Aha ratra. Aha means day and ratra means night. So day and night. It includes 24 hours. So 24-hour digestion sneha is the first, and it is known as the pradhana matra. And the second one is madhyama matra, that is aha. It takes 12 hours for digestion. So this is the 12 hour for digestion, that is the madhyama matra. And hraswa matra, that is the artha. It is about 6 hours for digestion, taking the digestion. So tasam prayogan vakshyami purusham prati. So we will see their prayoga depending on the persons. Okay, next slogan. Indications of uttama matra. In which conditions, in which kind of persons we can indicate uttama matra. First, we are dealing with the kind of persons, the person specific indications for uttama matra. It can be indicated in such persons where Prabodha Sneha Nityaye Shuddhivasa Sahadara Pavagascha Uttama Balo Yesham Ye Cha Uttama Bale. So these are the person specific indication. Prabodha Sneha Nitya. It is explained in Tika like Prabodha Sneha Satnya. The persons who are habituated to Sneha daily. So they will be having the habituation of taking sneha in very much quantities. So they will be capable for taking 24-hour digestion snehapana matra. Prabodha sneha nityaye shudpibasa saha nara. So shudpibasa saha. The persons who can withstand hungry and who can withstand thirst, etc. Pavagascha uttama balo, and the persons who are having good digestive capability. Eshamcha Uttama Bele, and who is having strength, good strength is there, then only we can administer Uttama Matra Snehabana. So Shutpivasa Saha, we all know that during Achabana Sneha, we are giving the ghee in the morning time. Suppose we are giving it on a day 7 a.m. on first day. So the 24 hours is like next day 7 a.m. So all this much of all this time he has to be he should have the ability to withstand thirst and appetite. So so that his digestive tract is that much capable to withstand with this much quantity of ghee. That is why it is uttama matra is mentioned for this kind of persons. Then we can go for the diseases where the Uttama Matra is indicated. Gulminaha, the persons who are affected with Gulma. Sarpadashta, after a snake bite. Visarpa Ubahada, it is not Visarpa, it is Visarpa Ubahada. What is Visarpa Ubahada? The person who is debilitated after Visarpa. The person who is who lose strength after Visarpa, we can use this kind of Uttamatra Snehapana. Unmattaha, the persons who are affected with Unmada, Kritramutra, difficulty in urination, or Kritramutra, dysuria, Gadavarchas, the persons who are having hard bowels. Piveir Uttamam Patram Tasyam Pane Gunam Srinu. And then in all these conditions, we have to give the best quantity of sneha, that is Uttamatra Sneha, and their benefits we will see in the next sloka. So here the Uttama Bala should be there. For Uttama Bala of Agni should be there. Shuddhi Basa Sahatva must be there, and Prabhuda Sneha Nityata should be there. So these are the conditions where we can give Uttamatra Snehamana. And in diseases, we can see some of the emergency situations like Sarpadashta, Krisramutra, Gadavarchas, etc. And some of the chronic debilitating disorder where Vada will be aggravated. So we need to have an early intervention. So these are the conditions where Uttamatra Sneha is indicated. And this Uttama Matra is specifically indicated for Shamana only, that we can understand from this. Shamana Snehapana Matra is this. Even though if we can, if we are intended to do this with Shodhana, then also we can use this Matra when Sarpadashta like conditions. So there also we have to give Yamamana, Virajana, Shodhana, etc. Then as so we have to attain the Samyasnigdha Lakshanas as earlier as possible. So we will give Uttamatra Snehavana in snake bite, etc. So this Uttamatra Snehavana can be given mainly, the indication is for Shamana, but we can give in Shodhana also. Then what are the effects or what are the benefits of Uttamatra Snehavana? Vigaran Shamayatyesham. So Shamana is already mentioned. So diseases will get alleviated. Shikram, as earlier as possible. That means the disease will get alleviated yearly. Shikram, quick action will be there. Samyak Prayojana, and we should give Samyak Prayojana, that is, we should use it properly and we should give it cautious. Right? We should be very cautious while administering this much quantity of Sneha to a person. So we should follow the patient for his Parihara Vishayas. Otherwise, it may cause complication. That is why it is mentioned Samyak Prayojana. Doshanu Karshani, and this will alleviate the doshas. Matra, Sarva Marga Anusarani, and this dose will pervade to all the channels in the body. That is, Sarva Marga is Koshta, Sandhi, Marma, Shakha, etc. All these channels, these Sneha will pervade and reach and will have an effect on these regions. Belya, and it will produce strength. Punarnavagari, it will refresh the Sharira, India, and Chetas, body in the sense organs and the mind. It will refresh these all these things. So this kind of Snehavana, Uttamatra Snehavana is producing this much of result. What we can see in Tika is Samyak Prayojita is Mahavyabhatti Tvamasyaha. Samyak Prayojita means if you are not using it properly, then it can cause bigger complications. So be cautious while using 24-hour Matra Sneha. Sarva Marga means Koshta Sandhi Marma Shakha. Every channel is related to all the Srotas, Abhyandara, Bahya and Madhyama Srotas. Punarnavagari. Punarnavagari is Nishesha Dosha Haratva. It will remove all the doshas. Then it will cause it will refresh the body. That is the thing. That is Uttama Matra Prayojana. And as per Shushruta, what is Uttama Matra Sneha? So we have dealt with Charaka, and now we are going to see what is mentioned by Shushruta for Uttama Matra Sneha. Ahoratrada Sandushta Ya Matra Perijiryadi. Within 24 hours, if the Sneha is not producing any complications, and it will get digestion, that matra is known as the Uttama Matra Snehapana. And the indications are Kushta. We know in case of Kushta, it will affect the last dhatu also. So from the first to last dhatu, this will affect it. Kushta may affect. So, and these conditions of chronic Kushta diseases and Vishonmadha, Visha, Unmada, poisonous situations where we have to give an immediate intervention. Then we can adopt Uttama Matra, Unmada, Graha, Apasmana, all these we can give Uttama Matra Snehamana. From the lines itself, it is we can clear that this Uttama Matra Snehamana is also indicated for Shamana only by Sushruta. Madhyama Matra Snehabana, its indications as per Charaka we will go. So Uttama Matra we have mentioned about the Uttama Matra. Now we will move on to the Madhyama Matra. Madhyama Matra is indicated for Arushka, Spoda, Pidaga, Kandu, Pama, Virabdidaha, Kushtirascha, Pramidascha, Vada Shonidikascha. So these are the disease specific conditions. Arushkara, Spoda, Pidaga, Kandu, Pama, all these are skin related skin disorders, right? Kushta, skin disorder, or all these are related to the metabolic problems. So metabolic disorders, Vada Shodhida is also a metabolic disorder. Prameha is also a metabolic disorder. So all these are related to the metabolic disorders, and in these cases we have to give Shodhana prior to Shamana medicine. So in that Shodhana, if we want to make Snehana, so we can use Madhyamatra Sneha. It is mentioned here. Nadi Bahuvashina Seva, the person specific are Nadi Bahuvashina Seva. The person is a moderate eater, not consuming very much quantity or not consuming less quantity. Mrudu Koshtaha, the persons are having delicate, soft bowel habits. Madhyamatra is indicated. So this is an entrance question. Like for Mrudu Koshta, which is the dose, which is the shorter Snehamana dose we can administer. That is the Madhya Matra. Most probably we will think about Hrasva Matra, but it is not Hrasva Matra, it is Madhya Matra only. And Pibeyoru Madhyama Matra, Madhyamaschabi Ebele. And the persons are having moderate strength also. We can administer Madhyama Matra Snehamana. Anushka is Arupshika. This is only the thing which is mentioned in the Tika. Then what are the benefits of Madhya Matra Snehavana? Matresha Mantavim Framsha Nachadi Balaharini Sukhena cha Snehedi Shodhanarte Chayujade. So this matra is Manda Vibhramsha. It is not producing that much impact as that of Uttama Matra Snehavana. So it is Manda Vibhramsha. And Nachadi Balaharini, and it will not produce the diminution of strength as much as the Uttamatra Snehamana. Sukhe Enacha Snehayadi, and it will cause the easy snehana of the person for Shodhana. Shodhanartha Chija. So Shodhanartha, this kind of Madhyamatra Snehavana is indicated. Shodhanartha Shodhananga Snehakarane. This is mentioned in Tika. Shodhanartha means we have to give it in Shodhananga Sneha Karane. So for Shodhananga Sneha, we are giving this Madhyamatra Snehamana. Edena Uttamatra Samshamane Evam Param Nadu Shodhananga Snehe Kartavya Iti. So we can understand here that Uttamatra is to be given for Samshamana, Shamana, and Madhya Matra for Shodhana. So this is not a strict advice because Eva Param. So for Shamshamana, Uttama Matra is Param. Uttama Matra is the best one. That doesn't mean that we can use Uttama Matra only for Shamana. We can use Uttama Matra for Shodhana also. But for Samshamana, Uttama Matra is the best dose. And for Samshodhana, this Madhya Matra is the best dose as per Charaka. मध्य मात्रा of सुश्रुता या मात्रा परिजीर्येतु तदा परिणते अहनि ग्लानिमूर्छा मदान्हित्वा सा मात्रा पूर्जिता भवेत्. So madhyama matras by sushruta, ya matra parijiryetu tada parinade ahani. So it will get digested after a daytime, that is 12 hours. Glani murcha madan hitva sa matra pujida bhave. So it will there is a common misinterpretation that this matra of snehavana will cause the alleviation or pacification of the diseases like glani, murcha, mada, etc. Actually, these are not disease conditions. These are physiological conditions created by the Snehapana that we will say in like Sneha Jiryamana Lakshanas. During the digestion of Sneha, these things will be produced. Glani, Murcha, Mada, these kind of symptoms will be produced, and these will be subsided after the digestion of Sneha. So, within the on the completion of a day, this Snehapana, if it recovers from Glani, Murcha, Mada, etc., produced as a result of Jiryamana Lakshana, then we can say that this is the Madhyama Matra, and this Matra is Pujida. Pujida for what? So, Pujida for Snehana, that is Shodhana before Sneha, Snehana before Shodhana. We can use this Madhyama Matra. ग्लान्यादिकं हित्वा या परिजीर्येति वचनात् स्नेहबाहुल्येन परिभागकाले ग्लान्यादयो भवन्तीति अवगम्यते. So because of sneha bahulya, during the paribhaga kala, glani etc. will be produced, and these glani etc. must be alleviated on the end of the day before 12 hours. So then we can see that this we have used the Madhyamatra Snehavana properly, and this proper advice of Madhyamatra Snehavana is excellent, and it is well known for the Shodhana purpose. Pujida bhavediti vachanada snehane ityaharaniyam. So snehane, this dose is pujaniya, that is well known, appreciated. या मात्रा परिजीर्येण चतुर्भाग अवशेषिते स्नेहनीया च सा मात्रा बहुदोषे च पूजिता. So as per Sushruta, this is given for Snehaniya, that is Bahudosha, 9-hour digestion. So Madhyamatra Snehapana as per Sushruta is of two kinds. One is 12-hour digestion, and the second one is 9-hour digestion. Both of these doses are mentioned for Shodhana only, that is Snehana only. Snehaniye cha samatra bahudoshe cha puja. When there is bahudosha, we have to do Shodhana. For Shodhana, we have to give Snehana first. So for this also, we have to give Snehana dose, that is the 9 hours for digestion. Snehaniya bahudoshe cha pujita. So this Madhya Mantra is also mentioned by Susuda. So Madhya Mantra, when on comparison with Charaga, we can say that Susuda told two types of two sessions in Madhyamata. One is the 9-hour digestion, and second one is a 12-hour digestion. Then Hraswamatra indications as per the Charaka. Yetu Vruddhascha Balascha Sukumara Suhojida Dikta Goshtatva Mahidam Yesham Mandagne Yeschaye. So this Hraswamatra is indicated for old persons, children's, Sukumara, delicate person, delicate physique, and Sukhojitaha, and the persons who are living in luxurious life. Rikta Koshtatvam, and the patients who are having very delicate bowels, or Ahidam, Ahida Koshtatvam. That means the persons who are not suitable for the intake of that much of ghee, and the patient cannot withstand. So in that case, and also Mandakneyascha, the persons who are having very less appetite or diminished digestive fire compared to the others. So in that cases, and also these are the person specific indications of Hraswamata. And then what are the disease specific Jara, Adisara, Kasascha, Yesham, Chita Samudhidaha. So in Jara, Adisara and Kasa, not for the fresh Jara, Adisara and Kasa, but it is indicated for Chira Samudhida, Jara, Adisara and Kasa. The Jara, Adisara and Kasa raised, and it is there for a long time. So it will cause the diminution of dhadus, it will diminish the strength, digestive fire, etc. So Deepana is the best treatment for that. For that Deepana, we have to administer this Krasvamata Snehapana for this kind of patients. Snehamatram Bibayuste Hraswam Echa Avara Bale. And in that cases, we have to administer Snehamatra, and it is Avarabala. Avarabala means the persons who are having very less strength. These are the indications of Snehamana, Hraswa Snehamana Matra. Benefits of Sneha Matra are Parihare Sugachesha Matra Snehana Brahmani Vrishya Belya Niravada Chiranchapya Nivartade. This is Parihare Sugachesha. It means that it is very easy to maintain this patient because we don't have to be very much cautious about, like wise in Uttama Matra Snehamana. The we should not follow the very much that is the parihara vishayas, etc. So the parihara is very easy as we are giving very less quantity of sneha. And this matra is snehana and brahmani. So two purpose are there. One is snehana and other is brahmana. So snehana is for shodhana. Definitely we can use this matra for shodhana, snehana before shodhana also, and brahmana, that is the shamana aspect of Hraswa Matra Snehamana. We know that generally when we are dividing the medicines, shamana and shodhana are the two main divisions, and in shamana it under Dibana, Pachana, Brahmana, all these we can include in Shamana itself. So here the Brahmana is also an effect of this Hraswamatra Snehabana, and it is also aphrodisiac. Vrishya in nature, Belia, it provides strength, Dirabada, and it is not producing that much complication. And Chiram Chapya Anuvartade, we can use this kind of Snehabana for long duration. Parihare Sukha idi Alpa Pariharatena, wherein there is very less uh, strength should be given for the Parihara Vishyas, that is the benefits of Rasoma Snehamatra, and we can advise this Snehamana for a long time without causing any type of complications. Hrasomatra of Susruda. So Susruda Chadurubhaga Gade Ya Matra Parijiriyeda Chadurubhaga Gade Ahani. So Chadurubhaga Gade Ahani, that means 1/4 of the day. That is the 3 hour digestion. Sa matra dibe tagni alpa doshe cha. So 3 hour digestion sneha is actually it is dibana, and it is alpa doshe cha bujida. It is indicated for alpa dosha. Ya matra parijiriyeda tada artha divase gade. And if the sneha is getting digested in half of the day, that is 12 hour digestion, 12 hour, half of the day means 1 by 12 by 2. That is the 12 hours is a day, and half of the day means 6 hour. So 6 hour digesting sneha should be advised for Madhya dosha cha bujida. Sa Vrishya Brahmani. So 6 hour digestion dose is mentioned by Charaka. The same Vrishya and Brahmana are mentioned as the gunas of this Hraswa Snehapana Matra. So Hraswa Matra of Susuda can be divided into two types, 3 hour digestion, and this one is the 6 hour digestion. And Madhya Matra of Susuda can be divided into two, that is 9 hour and 12 hour. And Hraswa Matra is indicated for Shamana purpose only by Susuda. There is no indication for any type of Shodhana like Snehana, etc. Here only Shamana purpose is mentioned. Either Dibana is mentioned in Alpadosha, or Vrishya and Brahmana are mentioned in Madhya dosha. So these are indicated for Shamana as per Shushruta. अन्द अस्ति प्रारम्भः आनो भद्राकृतवो यन्दु विश्वदः श्रवणार्थं धन्यवादः।